The Canterbury DHB joins the Southern DHB as having its deficit aired in public, but there are 20 DHBs in New Zealand, and at the end of May they were forecasting a combined year-end deficit of $99 million. In June, the Ministry of Health met with Lakes, Tairawhiti, Waikato, Capital and Coast, Hutt Valley, Wairarapa and Southern DHBs to discuss their financial performance. And at the end of May, Auckland counties, Manukau, Northland, Bay of Plenty, Lakes, Tairawhiti, Waikato, Hawke's Bay, Hutt Valley, Wairarapa, Nelson Marlborough, South Canterbury and West Coast were being monitored for unfavourable financial forecasts. So what is the total projected deficit for the country's 20 DHBs in the financial year that's just begun, 17-18? And how much larger is it projected to be than the actual current position?
I can't tell you off the top of my head, but I mean, the last one I've seen was somewhere between 50 and 100 million, but look, I'd just have to go and check the figures. I think the last one might have been 64 million.
That's Jonathan Coleman on Checkpoint 2 Fridays ago. We're running it again because he wasn't available to be interviewed today. For the past month, Checkpoint has been examining the financial health of the country's DHBs. We've been concentrating on the Southern DHB, as many of you will have heard, but in that time we've become increasingly aware it's not alone in struggling to rein in its deficit. A week and a half ago, we asked the Health Minister what the total deficit of the country's 20 DHBs was.
Well, they all need, monitoring to make sure they're on track. I mean, look, this is a sector where, the money is always tight, and in order to keep those deficits down, it needs constant monitoring and liaison with the Ministry of Health.
In the meantime, they have what has been described to me today as punitive financial targets, which are impacting on their ability to give the care they hope to give.
No, I disagree with that.
Now, that figure's current, or recent anyway, not projected for the year ahead. But if the Canterbury DHB has a draft annual plan with a deficit figure of $54 million for the 17-18 financial year, and Jonathan Coleman told us the most recent figure he had was $64 million for all 20 DHBs, including Canterbury, then the total deficit appears to be growing fast. Checkpoint has received a highly confidential briefing from an official privy to DHB projected financial outturns for the 17-18 year. We believe the projected figure, without efficiencies, is significantly higher than the $64 million current or recent figure that Dr. Coleman cited on Checkpoint. Double that, perhaps even more. The Canterbury documentation obtained by Fairfax warns of significant service cuts if the deficit isn't approved. Checkpoint has surveyed 9 DHBs about the pressure they're under to avoid or reduce deficits. Their descriptions range from challenging to punitive. As you heard, the Minister disputes the term punitive, but when I asked him about the pressure on DHBs from the Ministry, he replied,
look, they definitely have to strive to live within their means, no question about that. We can't have the deficits absolutely blowing out.
Is the deficit blowing out? You said that it was somewhere between 50 and 100 million. The latest figure I have is 99 million.
It's increasing, but it's not near the level of what it was at the end of 2008, where it was 150 million. But look, without continued discipline, those things can get out of hand.
Treasury tells us how the country's DHBs have approached the 17-18 financial year. In February, Treasury released its review of the DHB financial performance up to the last complete financial year. It uses green, amber and red to measure performance. Green means no particular concern, amber means some concern, red means concerns. There are 20 DHBs, 11 are amber or red. Canterbury, red.
Weak balance sheet remains significantly affected by recent earthquakes, maybe having trouble funding asset maintenance and repairs.
Capital and Coast, which is Wellington City and suburbs, Porirua and parts of the Kapiti Coast, red.
Relatively high unplanned deficit in 2016 and weak balance sheet.
Hutt, amber. Lakes, which is Turangi, Taupo and Rotorua, amber.
Maybe having trouble funding asset maintenance and repairs.
South Canterbury, which is Timaru, Rangitata to Waimate and inland to Mount Cook, amber.
May be having trouble funding asset maintenance and repairs.
Southern, which is Otago and Southland, red.
Weak balance sheet. May be having trouble funding asset maintenance and repairs.
Tairawhiti, which is Gisborne and the east coast above it, red.
A weak balance sheet. May be having trouble funding asset maintenance and repairs.
Taranaki, red.
Limited liquid assets on its balance sheet.
Waikato, amber.
May be having trouble funding asset maintenance and repairs.
Wairarapa, red.
The balance sheet is weak. May be having trouble funding asset maintenance and repairs.
And West Coast, amber. Now, in Section 4 of the review, Financial Management and Efficiency, Treasury summarises the financial performance of the sector has deteriorated in the last couple of years. Checkpoint has been told by a senior ministry source the situation is now worse. 7 of 20 DHBs are reported as having trouble funding asset maintenance and repairs. Checkpoint has been told, again by a senior source in the ministry, that efficiencies are being achieved through deferred maintenance and there is a growing backup of CapEx that's required.
But look, the background to that, though, John, is $888 million injected into the sector this year, biggest rise in 11 years. So more money is going in, but there's no question more money always helps.
Yes, indeed. So do answers, and today there haven't been many of them. Neither the minister nor the ministry were available to be interviewed. In fact, the ministry hasn't agreed to an interview once during this entire process, spanning well over 3 weeks now. But Checkpoint has been told they've received draft annual plans for the 17-18 financial year from almost all DHBs. 2 or 3 are submitting late. None have yet been approved, and their projected deficits combine to a substantially higher figure than the current ballpark, as discussed with the Minister on the 11th.
Oh, look, there's no question financial pressure is increasing, but the deficits are still well below the level we inherited from the last government when deficits were about $150 million a year. They're still considerably less than that. They're less than $100 million.
So what is the latest deficit figure you have if it's less than $100 million?
I can't tell you off the top of my head, but I mean, the last one I've seen was somewhere between 50 and 100 million, but look, I'd just have to go and check the figures. I think the last one might have been 64 million.
I have the most recent one that you've been sent, as far as I'm aware. As at 31st of May 2013, the sector's forecasting a year-end deficit result of $99 million.
Oh, that's the forecast as opposed to the current position.
So that's the Minister who wouldn't be available for an interview today, nor would the Ministry. Now, the Ministry has the draft annual plans. The draft annual plans contain deficit projections. What do they add up to? No one would tell us, but we understand it is a far greater sum than the figures the Minister was talking about. Michael Hundleby, who's the Director, Critical Projects, Ministry of Health, sent us a statement. Every year DHBs submit their draft annual plans to the Ministry for review and discussion. This process is currently underway and none have been confirmed. We will keep working on this.